Hello, everyone. I'm Lana Zach. Thank you for joining me. The highly contagious coronavirus variant, first identified in South Africa, is now in the U.S. 2 people have been infected in South Carolina. Neither had a recent travel history, and early data from the CDC suggests this strain may spread faster than others. The variant, discovered in South Africa, along with 2 others first detected in the UK and Brazil, are raising concerns about another possible surge in cases. Infections here in the U.S. are quickly approaching 26 million, and the death toll stands at more than 432,000. The Biden administration faces mounting pressure to get more Americans vaccinated. More than 26 million doses had been administered as of Thursday morning, but officials say in every state that they are running out of shots. And experts with the World Health Organization have been released from quarantine in Wuhan, China. The team will lead an investigation into the source of COVID-19 at Ground Zero. Mola Lenghi leads us off with our coverage from New York City.
Tonight, South Carolina's governor is telling residents not to panic after 2 cases of the highly contagious COVID strain, first identified in South Africa, were detected in the state. South Carolina now ranked 2nd in the nation for new COVID cases per capita.
Is yet another reminder that the fight against this deadly virus is far from over.
2 adults with no recent travel history and no connection to each other tested positive for the variant in different parts of South Carolina. Former CDC Director Dr. Tom Frieden.
Here's the bottom line. The more uncontrolled spread of virus there is in this country or anywhere in the world, the more likely it is that strains will emerge and spread which are either more infectious or potentially even more lethal.
The race to get Americans vaccinated is growing more urgent each day. But tonight, reports that an additional dose can be squeezed out of Pfizer's vaccine vial are being tempered by a shortage in the special syringes needed to do it.
We're solving for problems as we go.
Pharmacist Jessica Daly is vice president of Premier, a healthcare company that streamlines medical supply purchases for thousands of hospitals and health systems.
Within the Pfizer vial, the expected number of doses is 5, but if you have the right equipment, you're able to pull out a 6th dose. We're continuing to see challenges for our members in securing those specific supplies.
And now this. Researchers from the National Institutes of Health found that expectant mothers who experienced severe COVID symptoms had a higher risk for complications during and after pregnancy, including cesarean delivery and preterm birth. And we learned today nursing home deaths in New York may have been 50% higher than reported, according to an Attorney General report. And the toll the pandemic continues to take on families was illustrated in this tweet by Phoenix-based surgeon Argavon Salas. The caption, "Here are the folks I've cared for with COVID who have died, big stack, and survived, little stack, in the last 2 months."
When we see statistics like 3,000 people have died or 4,000 people have died, honestly, I think at this point people are pretty numb to that. And I thought it might be helpful for people to see what happens when patients are in the ICU.
Pharmaceutical firm Novavax says their new vaccine works well, but is particularly less effective against that new South African variant of the virus. Lana?
Mola, thank you. For more, let's now turn to Dr. David Hirschwerk. He specializes in infectious diseases at Northwell Health. Doctor, first of all, thank you for all of the work that you do on behalf of all Americans, and thank you for joining us tonight. So let's talk, first of all, about this variant. South Carolina is reporting at least 2 cases of the coronavirus variant first identified in South Africa. Neither patient, as I mentioned previously, is believed to have traveled recently. So what does this tell us about the new threat that this strain poses?
Right. So it makes it likely that there's a significant amount of the virus that's already in the U.S. and that, it is in the community already at this time. The fact that these individuals did not travel, they have no relation to each other. We have not done much sequencing of the virus overall, so it's hard to really quantify how much of these variants exist. But the fact that 2 people who haven't traveled and are unrelated have been identified as having it does suggest that there's at least some degree of community spread at this point.
How concerned are you, given what we're led to believe about these variants being potentially more infectious, that these variants, all of them, that they might fuel another surge here in the United States?
Yeah, I think that is a real concern, and that they're roughly 50% more contagious than the wild type or the standard strain that we've been dealing with since the beginning. And we already, as a country, are dealing with very high numbers of infection throughout. So even though the numbers have been better over the last week and the numbers are coming down, they're still alarmingly high. And to have yet another strain that is more contagious be on top of what we're dealing with right now, there's no question that that's a concern.
The company Novavax says its vaccine is more than 89% effective in UK trials, but not as effective against the mutant strains that are spreading in the UK and South Africa. Still, Dr. Hirschwerk, is this potentially good news that another vaccine may be close? And how concerned do we need to be as we're going through all these vaccination efforts that these new vaccines are in fact going to be able to effectively combat these new strains that are starting to show themselves here?
Well, there's no question that it is a good thing that there's more good news about new vaccines that will become available in the next few months to us, because the more types of vaccine that we have available, the better it is. We're currently dealing still with a supply problem overall in the country. It is not a surprise that the degree of effectiveness is less with these novel strains compared to the standard strain of virus, because the initial vaccinations were really designed based upon the spike protein from the original strain. So as some of these strains evolve and mutate, and there are newer strains, it is not a surprise that the current vaccines may not work to the same level. However, they are still effective, and even if the vaccine is slightly less effective, that could still mean the difference between somebody becoming very sick and just becoming minimally symptomatic. So I think that there's still a lot to be optimistic about the current vaccines. But again, I think that it is something that would be expected, that the vaccines are not quite as effective as they are with the original strain.
Would we then be looking at booster shots or another type of vaccine for people who potentially are being covered by vaccines that are less effective against these strains?
Yeah, so Moderna has this week reported that they do intend to develop a booster to study, so that they are hopeful that they'll have another tool to provide additional effectiveness against these novel strains. And I think that is what we will likely see, is that as the pandemic continues to evolve and we are seeing different strains emerge, that the companies that produce the vaccines will continue to adjust the vaccines in a way that retain a significant degree of effectiveness. Because again, even though there was 95% effectiveness with the Moderna and the Pfizer vaccine for the standard strains, even if we get to the point where we're dealing with strains that are, let's say, only 70% effective, again, that still could mean the difference between getting severe disease and mild disease. And ultimately, that's really what you're trying to prevent. You're trying to vaccinate enough people in a safe fashion to prevent them from getting disease severe enough that it makes them so sick that they have to be hospitalized, and really other significant health problems occurring.
That's a good reminder. That is not merely a blanket vaccination to keep you from getting sick at all, but even if you do get sick, that it might help to lessen the severity of the illness. Doctor, more than 26 million. Yes, please.
Oh, I was going to say that the influenza vaccine that we take each season is about 60% effective. So the real message with influenza vaccines should be not the guarantee that it will prevent influenza, but the following is that if you get the influenza vaccine, it may prevent you from getting influenza. But more importantly, if you get it, it is not going to be nearly as severe. It's going to last a much shorter period of time in you, and that you will be less likely to transmit it to friends and loved ones. And something similar can be said with these current vaccines if they are not at 95% effectiveness, but they still remain largely effective.
I think that's such an important message because given how effective at least the first two vaccines have been against the initial strain of the coronavirus, we're looking at it in a very different way than we normally think about vaccines, at least in comparison to influenza. Last question for you, Doctor. More than 26 million coronavirus vaccine doses have been administered in the United States. The nation is administering more than 1 million doses on average a day since the new administration took office. Still, how many more Americans need to be vaccinated? I feel like this is almost a math question for you, but how many more Americans need to be vaccinated for us to see a major improvement in fighting this pandemic?
Yeah, so the concept of herd immunity really is that we need to get probably 80% of Americans protected against the virus. And that's a combination of having been infected and having immunity triggered by that, or having received the vaccine. And once that gets to about 80%, although nobody knows the real number, it is felt that the degree of transmission will significantly diminish, though not completely go away. But it will significantly diminish enough that we can, as a community, live in a way that is at least closer to normal than we're currently dealing with.
All right, Dr. David Hirschwerk, thank you.
My pleasure.